I'm Bulchandani. I'm an endocrinologist practicing in Tennessee, and this is my daughter Eesha. And today we're here to tell you more about physician wellness. I think nowadays physician wellness is gaining a lot of attention, and my daughter actually prompted me to look at it a little bit more closer. She asked me a few questions, and then we designed this survey. So she's here to tell you a little bit more about it.
I found my dad one day. He was looking very tired, and he was just really doing anything he wanted to. And I'm like, do you have rules that you have to follow? And he's like, yes, for the general public and for us, but also kind of no. It's called CDC guidelines. CDC stands for Centers of Disease Control. So I told my mom, because she's an endocrinologist, so I told my mom, can we look into this more? I really want to know more about this. So she went and told me more about it, and we designed a survey. Here are just a few questions on the survey. Do you sleep 7 hours each day, at least? And we found out that most physicians don't. 25% do, and 25% don't. So 75% don't.
Yes. So there were other questions that were also a part of the survey, and some of the questions were if they were eating vegetables, fruits, if they were consuming sweetened beverages, if they were sticking to the guidelines of sodium consumption, which is also very important. And in contrast, most physicians were able to respond positively to exercise. They said that they do try to exercise or get their steps during their rounds and their clinical activity, but they don't get enough sleep. They were also 50% of them were able to eat good food, and they were trying to eat healthy food, including vegetables and fruit. And most of them were very confident that they were not drinking sweetened beverages or other beverages that would not be healthy. So keeping everything in mind, what was most neglected was sleep. And I think it has a lot of factors responsible for this scenario. I think few of the factors that I can list, since I'm an endocrinologist, my husband is a practicing gastroenterologist, and I feel like EMR documentation, electronic medical record documentation nowadays is taking away a lot of time. We do have protection for residents, but when we step out into the real world, physicians don't have any protection. They don't have any rules that are set for them. So they could take a call, and the next day they have to meet the guidelines for insurances and submit their paperwork. So I think that is taking a toll on them, and the one thing that's most neglected is the sleep. I was actually surprised. What was so interesting is most physicians said that they do exercise, which I didn't think was very important few years ago. So I think there's a lot of awareness about exercise, and also there are a lot of facilities now for physicians to exercise. Like the hospitals have their own gym, and if the physician is traveling, then hotels and other places, they have a particular area where they can exercise or walk or so on. They have apps on their phone. We have Fitbit. I mean, I think we have a lot of resources to channel that into our mind that we have to exercise. But when it comes to sleep, I think a little bit, I would also say that because of the social media, and maybe if the person wants to relax, they may just go and surf their net and surf the phone and watch internet, and that may take some time away from sleep.
So on the survey, we had the age of the doctor, the gender of the doctor, and the doctor's specialty. We based these questions on a scale of 1 through 5. 5 being all the time, 1 being not at all, and 4, 3, and 2 were in the middle. We compared 4 and 5 to 3, 2, and 1.
And we want to do this on a larger scale. I mean, this was only including the physicians but we want to include more physicians, recruit more physicians. It'll be good to compare this to residents who are in practice, and also other providers like physician assistants and nurse practitioners and nurses themselves, and it will be good to study it on a larger scale, and then have some rules like for the physicians too, some protection and maybe some rules.